That's my hello.
That's his new quarantine hello, guys.
What's up? I have a quarantine cut and a quarantine wave. We thought today we would we'd ask folks for just their kind of general questions. We had a lot of really interesting ones, so we're going to go over those. Also wanted to wish everyone Happy Nurses Week, and I think today's actually Nurses Day.
Woo-hoo.
So Happy Nurses Day to everyone. I want to obviously thank my staff and Olivia here, who's kind of run the nursing show for us here the last 2 months. She's been awesome. And to all my nurses that are waiting at home eagerly and anxiously to get back and have just been awesome. We just love all of them. And obviously all the frontline workers, first responders that are taking such good care of our friends and family during a really, really hard time that puts them at a lot of risk. They really are heroes. I know that word's thrown around a lot, heroes, but if you can imagine these folks putting on all this protective gear and going into a room with a patient that they know has an illness that could really affect their own health and doing it day after day, hour after hour. These are really, really heroes. And it's not just the nurses, it's the medical assistants and respiratory techs and the docs and the firefighters and the police officers. I mean, really, they really are, and we should thank them appropriately. So from us to you, thank you so much for what you do. It's true bravery. So to talk about some fun stuff, we had a whole bunch of interesting questions and a lot of hellos, and which is always fun to get. I like things like "Have the best day." That was great from the Derma Contour AU. I'm wondering if AU is Australia. So if that is, thanks. Here's my quarantine high again. We're doing that twice. So let's talk about some of the questions. So Cass Becker asked a question about breast lifts after weight loss. Yeah, we do breast lifts for all sorts of reasons. After child birth and breastfeeding, breast can change. Some women just, without anything like that, breasts are just drooping a bit and not quite where they want them to be. And certainly after weight loss. The challenges after weight loss are always about how the skin is reacted to that weight loss. So patients who lose a lot of weight quickly from surgical weight loss, they tend to have really loose, thin skin. And so it can be a little bit more challenging, but the results are great. I do tell patients in that situation that sometimes their risk of needing a revision, needing it tightened up again, goes up a bit, because no matter how tight we make it during the surgery, it can loosen up over time just because of the skin quality. But really high satisfaction operation, and sometimes just a small implant if folks want a little bit of fullness, that can help as well. Usually those two can be done together, the augmentation and the lift. Let's see. We already done a whole thing on differences in breast implants. This is a question from Yules Clean, so I urge you to look at our old Instagram lives for that, because they're pretty great, and we're just posting it on our YouTube channel.
I was going to say, where can you find those?
Well, great question, Olivia. Where can we find those? The YouTubes, as the
YouTubes,
as the
young folk.
The young folks call it the YouTubes, just like me. Yeah, we have on our YouTube channel. We are putting together a lot of videos on what we've talked about during this quarantine pandemic time, but also some interesting things that we've done. Olivia and one of our other nurses, Christine, have put together some really great videos for patient education. So what to expect after surgery, that kind of things. We'll go over all that with our patients, of course, but it's just another reference so folks can kind of get ahead of the game and learn what we are going to be talking to them about. So a lot of content on YouTube, and we're gonna get that on our other social media. We're gonna get it on Realself and on our website as well.
They just called it the socials.
The socials? Is that what it is?
Yeah.
Okay, sorry. I basically, there was, just as an aside, there was a time when I first started my practice where I was younger than all of my staff. Like I was the youngest person in the room. That's gone. Now I'm the oldest. All my nurses are like, people don't say that anymore. So
it's fun to remind you as well.
It is fun, and now I have this sort of like fatherly concern for everybody, making sure they're okay.
How's your boyfriend treating you?
Yeah, I do ask that a lot, but not in a slimy way. I want to ask in a very sort of like, paternal kind of way.
Has he changed your oil?
Yeah, is he a good one? Is he taking you guys out? Making sure he's taking good care of you. If not, give me a call, because I have daughters, and I got to make sure that one day they're taken care of well. So let's talk about a couple other questions. Sorry, tangent. Downsizing breast implants. This is from the Mare Goat. That's a good one. Yeah, that's actually a common thing for patients after breast augmentation, somewhere in the future, to want bigger implants, smaller implants. Downsizing it is a pretty straightforward operation. It depends on a little bit on what the breast looks like to start. So if the shape is good, the quality of the skin is good, there's no need for a breast lift, that kind of thing. Taking out implants and going down a little bit in size is a pretty straightforward thing. Occasionally, if we're going down a lot in size, then we may want to talk about other options to get the breast shape really nice, such as a breast lift, but certainly downsizing implants is perfectly reasonable. Arm lifts and thigh lifts. This is from Kelly Julene. Yeah, really popular operations, especially after weight loss. Arm lifts, I think, versus thigh lifts. Let's kind of talk about that. Arm lift is certainly a more common operation, at least in our practice, and typically we're making an incision either on the inside of the upper arm, kind of if I put my arm out like that, from the elbow to the armpit, or on the back of the arm, from the back of the elbow to the armpit. Just depends on kind of the distribution of the skin and fat. Removing that extra skin and fat works great. Thigh lifts, typically we're talking about either a medial thigh lift or kind of an outer flank thigh lift that goes as that's part of a lower body lift. The important thing to tell patients is that inner thigh lift operation, it's probably the one operation where I really, really spend a lot of time with patients trying to almost discourage them from doing it unless they really, really want it and really need it. And why is that? Because the skin of the inner thigh is very thin, and that part of the body is prone to having healing issues. And I think that's a pretty fair assessment. For most patients, most surgeons, they're going to have, it's a harder part of the body to get to heal right. So if someone has just a little bit of loose skin there, I'm usually not a big proponent of doing that operation, but if you have a lot of loose skin and fat that's really affecting the quality of your life and you're willing to have a long incision, typically in the groin and kind of down the inside of the leg, I think it's worth doing it. But it's one of those operations where you got to be willing to accept a higher risk of having a healing issue that will eventually heal, but it takes longer compared to most other surgeries.
Two questions on here.
Yeah.
One of them is when will you be taking new clients for consultation? Can she reschedule her appointment next week? If so, she's so excited.
Yeah, sure. So we're doing virtual consults now. So we talk on, you send photos, we talk about kind of what your goals are, and then we can and then we can see you in person down the road depending on your schedule. We're going to start seeing patients in person the week of May 18th. We think that's probably the right time in terms of kind of what the trends are with the state. But yeah, May 18th, May 19th. If you have an appointment for next week and you'd like to change it to another day, it's totally fine. It's no problem. Just call our office and we can do that for you.
Another question is how we deal with out-of-state patients.
Yeah, that's a great question. So we do get a lot of patients from out of state. And coming from all over. We have folks from Hawaii, we have folks from East Coast, we even have some overseas folks. And that's pretty common. A lot of plastic surgeons have that. It all depends on what they want to do. Typically it starts with a phone call, just to kind of chat about their goals. They'll sometimes send photos so we can review their photos in advance. Occasionally if they want to do like a Skype or a FaceTime or even now Zoom, we can do that. It's okay. But we do eventually need to see them in person. It just depends a little bit on their scheduling. Sometimes they're coming out to Seattle anyway, and we can see them then. Sometimes patients say, look, I can only make one trip out, so we do as much as we can with them over the phone and online, and then we see them in person prior to surgery. And if we need to change the plan or adjust things, then we can totally do that. But we love seeing out-of-town patients. We see them all the time. Good. So let's talk about, okay. It's a great question. We have a question just wanting me to talk about breast reductions in general. That's a big topic, but let's just briefly talk about it. Breast reduction is one of the most popular cosmetic operations there is. And the reason why is that you're getting both a cosmetic operation as well as a functional operation. So the cosmetic side is making the breast look nicer, making the breast lifted, making it smaller. The functional side is typically women who have heavy pendulous breasts will have a lot of upper back and neck pain, shoulder grooving, problems with skin breakdown, and really just problems fitting comfortably in clothing, working out, all those kind of things. So you're getting that benefit too, so functional and cosmetic. The incisions are similar as for a breast lift, which is what's called an anchor pattern. So incision completely around the areola, down the breast and underneath. When we make the incision completely around the areola, we're often, for women with larger areolas, we're making them smaller, so it looks more youthful. And then we remove excess tissue. Every surgeon does it a little bit differently in terms of where they remove the excess tissue. In our practice, we're trying to remove excess from where most women have the excess, which is kind of the lower outer portion of the breast, and then leaving it where women want the fullness, which is typically the cleavage line in the center of the breast. And then we lift the breast up, redrape and remove the extra skin and close the incisions. High satisfaction operation. Risks are always there, just like with any surgery, but something that we do a lot. One important thing about that, and I try to tell all my patients this, is that for some women, that operation is covered by your health insurance, especially if the breasts are really heavy and painful. And for other women, it isn't. In our practice, we don't contract with any health insurance, so if you're really wanting it to get it covered by insurance, I would recommend talking to a plastic surgeon that does take health insurance for these procedures. And truthfully, there's a lot of really good plastic surgeons in our community who do that operation regularly and get great results and work with insurance companies. We just don't happen to be one of those folks. We still get a lot of patients that want us to do their reduction and are happy to pay for it, but just want to let you know that you do have that choice, and there's some good folks in town that do it. Let's see. How about, let me see what other questions. Okay, so let's talk about types of anesthetic. This is a great question. So when we work with only board certified anesthesiologists, those are the folks that provide our anesthetic services for our office. I've been working with the same group of doctors for over 10 years now. They are wonderful. I would trust my own family with any of them. And the type of anesthetic they would offer you really depends on the operation, what can be done for that particular operation, and then what your goals are. So for example, let's take a tummy tuck. You can do a tummy tuck with either a general anesthetic, which is where there's a tube either all the way in your throat or kind of in the back of your throat. It's called an LMA. And where you're completely asleep, you don't remember or feel anything. Or you can do it with what's called a spinal anesthetic, which is kind of like an epidural, but they do a little injection of numbing medicine in your lower back, and then it numbs you from that area down. They also will give you some sedation. Most folks want a little bit of sedation, so they don't remember or feel any of it, but they're breathing on their own the whole surgery. The folks for our tummy tucks, we do it both ways, just depends on what the patient wants. I'll tell you, the folks who get a spinal anesthetic, they love it because they wake up real quick. They have a very sort of a pleasant experience. They don't remember or feel any of it, and we tend to be able to get them a really nice result for their tummy tuck with that. But either way is fine. It just really depends on the patient, and sometimes we can do for operations that are not quite as involved. We can do just some sedation with the anesthesiologist, but that's the advantage of having a really great group of anesthesiologists, which we do. We can kind of tailor the anesthetic based on what the patient wants.
2 questions.
Yeah.
Do we offer financing for our surgeries?
Oh, yeah. Sorry. Yeah, we do. We work with something called Care Credit. You may have heard of it. You can look it up online, Care Credit. It's a pretty common financing resource for patients. I would say most plastic surgeons use it. And it works great. They have lots of different programs, and our coordinator, Rebecca, can certainly go over that with you. I think some of our patients even just go online and get pre-approved for financing through Care Credit before they even come to see us. So a lot of folks do that, so they're kind of ready to go.
And what does board certification mean?
Oh, that's who asked that question?
Shay.
That is a great question, Shay. So let's talk about that. So you're going to hear the phrase board certified thrown out a lot. So let's talk about what that means. When we're talking about it as board certified plastic surgeons, what we mean is we're certified by the American Board of Plastic Surgery. The only way a surgeon can be certified by the American Board of Plastic Surgery is you have to first graduate from a plastic surgery residency program, and that plastic surgery residency program has to be a approved program. There's a group called the American Board of Medical Examiners that determines what board eligibility means. And so you have to go through a proper training program first. And then you are, once you complete that program, which for plastic surgery can be anywhere between 5 to 7 years, depending on what type of program you go through. Then you're in practice. You have to take a written exam. You have to then take an oral exam. And that process takes about 1.5 years, maybe 2 years after that, before you can become board certified. Now that's important because there's a lot of doctors out there who will say they're board certified cosmetic surgeons. That is not the same. And it's a very important distinction. A cosmetic surgeon does not have to do any sort of formal plastic surgery training. They can be a general surgeon. They can be an ear, nose, and throat surgeon who now decides they want to do breast augmentation. They're very different training programs. And what I tell all my patients is, look, in a place especially like Seattle, I think there's a lot of really good board certified plastic surgeons. And I'm always happy to give patients references to other doctors in town that I really trust, I think are wonderful doctors. The one thing I urge folks to do is, if you want to have plastic surgery, go to a board certified plastic surgeon. That is the best advice I can give you. If I wanted to have ear, nose, and throat surgery, I would go to a board certified ear, nose, and throat surgeon. If I wanted to have neurosurgery, I would go to a board certified neurosurgeon. It's kind of the same idea. I think that's a good baseline litmus test of safety and proper training to go with. But it's a great question. Always look for board certification by the American Board of Plastic Surgery. Good question. So, let's see. Why can't I work out for 6 weeks after surgery? It's because Olivia won't let you. She's mean. I think everyone should just start running immediately, but she says no. No, it's
Spartan races.
Spartan races immediately. We can always talk about Spartan races. Yeah, that's kind of my pastime, although I haven't been able to do any this year yet. Basically the short answer is we're trying to give the body enough time to heal. Invariably, patients feel ready to go well in advance of that 6 weeks, but it doesn't mean you're totally healed. And if you start to do too much too soon, you can get into real trouble, either with bleeding or incisions opening, pore scarring, that kind of thing. So we have to give your body enough time to completely heal. And 6 weeks is a pretty good general number. There are certainly surgeons and different procedures that can go a little bit earlier than that, or maybe a little bit later. It just depends on the doc. Best advice, listen to your doctor. If they say 4 weeks, do 4 weeks. If they say 8 weeks, do 8 weeks. But just really listen to what they're asking you to do.
So if someone's had a breast aug, can they do squats, lunges, lower body exercises?
They absolutely can at 6 weeks.
Perfect.
I mean, that's for me. So what I tell patients is, look, you're spending a lot of money doing this operation. You're taking out a lot of time. It's a big deal. It shouldn't be just we shouldn't approach it as, oh, this is not real surgery. It's not a big deal. It is. You're spending a lot of time, money. There's real risk. So the best thing we can do is try to maximize your chances of having the best cosmetic outcome. And part of that is this annoying thing about really, really forcing you to take it easy, not getting your heart rate up. Walking is fine, but nothing where you're bearing down or straining. So 6 weeks, and I know it's painful. I can't go a few days without exercising. It drives me crazy. So I get it. But it's really the best medicine, just some time. And let's see, what else? We can go into the fun stuff later. There's some fun questions there. Will I continue virtual consults? Yeah, we'll after we reopen. Yeah, we'll still do them for folks who would prefer that versus coming in, or for folks who are from out of town. We can absolutely do that. Look, we're here to help you. If you'd rather not come in and do the initial consult over the phone, it's totally fine. Sometimes we can't, it's hard to fully assess you without seeing you in person, but we can certainly get the ball rolling with a virtual consult. And then, here's a question from Heatherfield 6411. As far as scarring goes, is it okay to get a breast lift with a breast augmentation? So, good question. In terms of the scarring, for most patients, I can't see an issue where that would be a problem. Now, breast augmentation and breast lift, that is a very, very delicate operation. There are certain patients who need both a breast lift to get the shape of the breast better and a breast augmentation to give them more fullness. Oftentimes it can be done as one operation, but sometimes it has to be divided into 2 operations. That comes down to a number of factors. The first factor really is the surgeon's comfort with that operation, because some surgeons feel very comfortable doing it as one operation more often than not. Other surgeons will never do it as one operation. They always divide it into 2. I think as a patient, what I would say is, if you like the work of the surgeon, whoever that is, and they recommend doing it a certain way, I would urge you to do it the way that they're recommending, because it really comes down to their comfort level. What's the risk of doing it all together? Sometimes you can get into problems with healing, especially if you have really heavy breasts with tight skin and then you want a really large implant. Those two operations will be fighting each other. The lift is trying to tighten up the breast envelope, the implant is trying to stretch the envelope, and they can fight against each other. Now compare that to a patient who has, maybe they've lost a lot of weight, they have really loose, thin skin, and not a lot of breast volume, and they want just a small implant. You're still making the breast larger with the implant and tightening the breast with the lift, but there's not as much tension against each other. And in those cases, they can be done together. So in general, you can do it together, but really have a good conversation with me or whoever your surgeon is going to be about the pros and cons of that.
How much are our virtual consults?
So for the month of April, which is now past, we were doing them complimentary. We're now back to our regular consult fee, which is $100. But if we do a virtual consult, we would also be, and you want to be seen in person as well, of course we're not going to charge you twice. You're going to have the consult, and then we'll see you in person. Just like any patient, if we see a patient in person for a consult, and then they want to come back for a second consult, we're not going to charge them each time we see them. We just charge them once.
And your $100 goes towards surgery.
Yeah, thank you, Olivia. Yes, and so the $100 goes toward the cost of your surgery. So if you decide to have surgery, it just goes into that fee.
Does a fat transfer create a similar result as an implant?
Oh, great question. These are some good questions coming out.
I can't read. Cassbacker.
Cassbacker. Great question, Cassbacker. So let's talk about that. Fat transfer is a really hot operation, especially for breast augmentation. There's pros and cons of fat transfer compared to breast implants. So when we transfer fat, we're taking fat. We pause a little bit, and then I was doing this. This is actually how my daughter looks when she's confused. So let's talk about that. So fat transfer is a procedure where we're taking fat from another part of your body with a type of liposuction, and then we're transferring it into each breast, typically into the breast tissue and into the plane between the breast tissue and the muscle. An implant is a device, we're putting that device typically behind the muscle. For women who don't want an implant, have really good shape to the breast to start, or we're going to create a better shape by doing a breast lift, and who want just a small amount of fullness, so between a half a cup to a cup, and also have some fat in another part of their body that they want to get rid of, those patients do great with fat transfer. On the other hand, if the patient says, I'm an A cup, I want to be a C, or I'm a B cup, I want to be a D, double D. In my experience, you can't get that much of a volume change with fat transfer alone. Now, there's probably some surgeons out there who would, maybe they claim they can or they're able to, and that's great if they're able to, but for us, half a cup to a cup is probably about it. What's nice about fat transfer is that it's your own tissue, so it's not an implant, it's not a device, so once it's healed, it's kind of there. That being said, no matter how we treat the fat, no matter the surgeon and no matter the patient, somewhere around 40% of the fat that we transfer is going to be reabsorbed over the first few months. Once we get out to about 3 months, 6 months, then your volume is kind of what it's going to be. So in some patients, or actually in most patients, we want to overcorrect, take more fat than we need to try to compensate for that reabsorption. And we also tell patients, look, there's certainly a possibility that after all is said and done, we may need to do another fat transfer to get you kind of the result you want. The advantage of an implant is you get a much more precise sense of the fullness, and that's permanent fullness. As long as the implant is there, you get that fullness. So I would say in our practice, it's still probably 90-95% of women are wanting an implant compared to a fat transfer. But it's really specific. It just depends on the patient's anatomy and what their goals are.
Should you try to lose the most weight possible before a tummy tuck? If you didn't, and then after you healed, would you have a lot of loose skin again?
Yeah, that's a good question. So what I tell patients is try to get close to the weight you want to live at before you have a tummy tuck. Often that's possible, but sometimes that's easier said than done. And it really depends on the patient. So if you were planning on losing 50 pounds, I would tell you lose the 50 pounds first, then have a tummy tuck. Now let's say you're planning on losing 50 and you lose 40 and you just are stalled. You're probably fine just to do the tummy tuck, and then afterwards, if you start to lose weight again, slowly, I think you would be okay with it. The mistake is to say, look, I have this weight loss plan, I'm going to lose 50, but I want to have the surgery right now. You do the surgery, and then you lose 50, you're probably going to have some loose skin that we would need to do a revision on. Now, there is a group of patients that I see more and more of who are really, really trying hard to eat right, exercise well, doing all the right things, but their weight loss has really, really stalled. We have good, honest conversation about the pros and cons of doing a tummy tuck in that situation. And what I've seen is more often than not, when we do a tummy tuck in that situation, what they tell me is afterwards, they feel better, they're able to exercise more easily, they're able to lose weight more easily, they see the results of their hard work more easily. And so in those patients, they sometimes will start to lose weight a little bit easier after they've had the tummy tuck. It's not for everybody, and there's plenty of patients who come in who are just not good candidates for the procedure. So we have to tailor it a little bit. But in general, patients know their bodies. They know what they can and can't do. And so we just have to have an honest conversation about it and then decide what the best choice is.
There was another question. Oh, possibly a silly question, but do braces affect the outcome of a nose job?
Oh, that's a good question. No, I don't think they do. We certainly do rhinoplasty in women who have braces and men who have braces. Now, sometimes I've had patients who come in who, and I probably have maybe 3 to 4 patients like this every year who come in for a rhinoplasty, and they also say, I don't like the way my chin looks. And when you look at their chin, it's not that the chin is that they have a weak chin. It's actually that the way their jaw is coming together is off. So they have kind of an overbite. So their lower jaw is not lined up with their upper jaw. It's too far back. Now those patients, I often recommend them seeing an oral surgeon, because sometimes in order to get the best, not just cosmetic outcome, but also functional outcome, is to have a surgery by an oral surgeon to bring their jaws in proper alignment. That's really important for their long-term oral and dental health, but it also brings their chin into a better position. So for those patients, I have them do that first, let it all heal, and then come and do a rhinoplasty. So I'm looking for that when I talk to patients. But if you just have braces, like many of us have, no, it won't affect what we do.
How many hours are you comfortable with having a patient under anesthesia, and how many procedures are you comfortable with doing all at once? A tummy tuck, labiaplasty, all in one? ?
Yeah. So how long a patient has an anesthetic and how long I'm comfortable doing, it really depends on the patient. Obviously, the most important determinant there is safety. So we don't want to put any patient through any undue risk. That being said, a tummy tuck and labiaplasty is very common and very easy to do together for most patients. It shouldn't be something we would divide up. My general sort of thought process is if I'm concerned at all that a surgery is going to be too long, we just tell them we're just going to divide it into 2 procedures or sometimes 3 procedures. We do that a lot for folks after massive weight loss where they need arm surgery, breast surgery, lower body lift, tummy tuck, thigh surgery. We're not going to do all that together. We're going to divide them into 2 or 3 operations. Yeah.
Can you achieve visual abdominal muscles after a tummy tuck?
Oh, that's a good question. I think it depends on your body fat percentage. Typically, it's more about how lean you are overall. So, for example, I've had patients who come in who have lost a lot of weight and they have this hanging apron of skin, but behind it, you can see their six-pack. It's just that the skin is hanging over it. So when we remove that, it's clearly visible. I don't think tummy tucks are, in general, designed to create a six-pack. I think the six-pack comes from you, and just like most, I would imagine, trainers would tell us that you get your six-packs in the kitchen, not in the gym.
Bummer.
Yeah, I know. Believe me, I'm in my 40s, and I definitely can attest to that. So it really comes down to what you're doing outside of what we do. But if they're there and you've developed them and we're able to remove the skin and fat that's hiding it, then yeah, you would see it. But we're not trying to create that visualization of the muscle or anything like that.
How do you know if a patient is a good candidate for a tummy tuck revision?
Oh, yeah, I mean, it depends on a lot of things. It depends on their overall health, their age, the surgery, the scars, what their goals are. And then finally, if I think I can achieve that. So most patients who are coming in who've had tummy tucks elsewhere, we're able to do something for them. How much better I can get it really depends what I've seen. I've seen some patients who unfortunately have had some really, really challenging things done to their abdomen that are going to require a big operation to make it better. Others, it's pretty straightforward, something simple. So it really depends on the patient, but typically we're able to offer something to them.
All right, we have a Botox question. Someone missed our Botox live.
Oh, no, it's okay.
Okay. Botox versus fillers in the areas, which one's best, maybe?
Yeah, so we talk about it really quick. So Botox is designed to temporarily relax muscles. So anywhere where you're getting a line due to muscle animation, that's where Botox helps. The 3 most common areas, and I can, just like I did on Botox Live, I can show my own face. You have vertical lines here. They're called the glabella. You have transverse lines here is on your frontalis, and then you have these kind of crow's feet or on the orbicularis muscle. Those are the places where Botox will work. Fillers are designed to add volume. So the places where we lose volume as we age are kind of the nasolabial folds, the lips, the midface. Those are the places where fillers will work best.
How does visceral fat affect the result of a tummy tuck?
Yeah, it certainly doesn't help it because that visceral fat is behind the muscle and that's pushing on the muscle tightening repair. So it makes it harder to get a flat abdomen. So some patients, when they come in and they need to lose weight, they need to lose weight in their viscera. So imagine like sometimes men as they age, they kind of have that beer gut, that beer belly. Those patients are not going to do well with a tummy tuck. They need to lose that weight. Surgery is not the answer for them. On the other hand, most women they may have some visceral fat, but most of the time they're carrying the fat in front of the muscle. That's the fat that can be improved with a tummy tuck. So part of our job when we examine you is to assess that and let you know what we think, if that surgery is going to help or not.
This kind of piggybacks that. It says, I've had trouble working on my abdominal muscles because of diastasis. If I get a tummy tuck, would that help build those muscles back?
Yeah, it doesn't help build the muscles back, but it does reapproximate the muscle. Now, there's no science or data or study that I'm aware of that talks about functional improvement of the abdomen or core after a tummy tuck. I'm not aware of it. There may be one out there, but I'm not aware of it. That being said, I've had many patients tell me, especially patients who are fit and healthy, who still are having trouble with their core strength. Sometimes they have lower back pain. They tell me, look, once we did the tummy tuck, I could just feel my core stronger. I was able to work out better. I was able to flatten my belly more. So anecdotally, it seems to help some folks. But always remember, a tummy tuck is a cosmetic operation. Any functional benefit you get is just, icing on the cake. It's not what it's designed to do.
What makes a male a good candidate for gynecomastia versus just losing weight?
Yeah, so men who have true gynecomastia, it's typically not just because they're a little overweight or not. Some men are. Some men I see who have gynecomastia are also a little bit overweight everywhere. But I've also seen skinny guys who have some true breast tissue, and that's what gynecomastia is. It's true breast tissue on a man. The most common form of gynecomastia is what's called idiopathic gynecomastia, which is fancy medical term for we don't know why you get it. Typically, it starts around puberty, and then it develops and stays there throughout their life. And even when they're super thin, they can still feel this hard, firm breast tissue. And so really the only treatment for that is surgical, is to go in and excise the tissue. And there's a lot of finesse going into how we do that so that we leave the contour of the chest in balance with the rest of their body. But it's not just about their weight. Some guys need to lose some weight before surgery, but most men, it's true breast tissue that's there. Good questions today. Final question was, what's your go-to coffee order? This one, a venti with a little bit of coconut milk and Splenda. That's kind of what I go for. Well, those are great questions, guys. I hope we answered it. We have, I think next week is our final scheduled Instagram Live. With any luck, the following week we'll be operating, so it'll be harder for us to do it. I'm sure Miss Olivia will make me do some more, which I think is wise. Hopefully folks find it helpful. Please keep questions coming. We'll think about kind of what next week's topic could be. It could be all things Olivia.
Oh my gosh.
I think that's probably more
Cats,
interesting than all things
true crime.
Yeah, cats and true crime. If she can watch like a true crime show while hugging her kitty, I think she's in a really, really happy place. Thanks for everything, guys, and hope everyone's staying safe, and fingers crossed, operate soon. Take care.